You have noted an increase in breath sounds in your assessments of Mr. Gonzalez, and you are preparing to implement orders for suctioning through his tracheostomy.
You give you a little bit extra oxygen because when I suction you, some of the oxygen comes out along with the secretions, okay? Your O2 stats right now are 100%, so that's good.
Hyperoxygenate Mr. Gonzalez before suctioning.
Give you a breath.
Use a manual resuscitator or ambu bag and connect it to the end of the artificial airway. Compress the bag gently 2 to 4 times. Connect one end of the connecting tubing to the suction machine. Place the other end in a convenient location. Then turn on the suction device. Follow manufacturer's instructions.
Okay, Mr. Gonzalez, I'm going to suction you out now.
Then prepare your supplies. Mr. Gonzalez is on contact precautions and his nurse wears clean gloves during each care procedure. A face shield is worn because there is a splash risk. Here she is opening a sterile glove package.
My sterile glove.
Then the suction catheter package using a septic technique. She connects the suction tubing with the sterile suction catheter, which is left in its sterile packaging. A sterile glove is then placed on the nurse's dominant hand before she continues.
Okay. And I've got my clean glove to my clean and my sterile glove to my sterile.
Prepare the suction catheter. When suctioning adults with artificial airways, suction catheters between 12 and 14 French are usually used. Suction a small amount of saline from the container to be sure the equipment is functioning properly. Without applying suction, gently and quickly insert the catheter until resistance is met or the patient coughs. Then retract the catheter about 1 centimeter and apply intermittent suction. Then, slowly withdraw the catheter while rotating it back and forth between your dominant thumb and forefinger. Watch for signs of respiratory distress and encourage your patient to cough. Discontinue suctioning if the patient develops severe paroxysms of coughing, develops pallor, indicates difficulty in breathing, or indicates discomfort. If your patient has a pulse oximeter or cardiac monitor, discontinue suctioning if one of the following occurs. The patient's pulse drops more than 20 beats per minute. The patient's pulse increases by more than 40 beats per minute, or if pulse oximetry falls below 90% or 5% from baseline. Rinse the catheter and connecting tubing with normal saline until it is clear. Allow adequate time, at least 1 full minute, between suction passes for ventilation and reoxygenation. Then, repeat the suctioning once or twice more to clear secretions. Perform nasal and oropharyngeal suctioning after clearing the trachea as needed. But remember, never reinsert the catheter into an endotracheal or tracheostomy tube after oral or nasal suctioning. Compare Mr. Gonzalez's respiratory status again after suctioning.
100% still. So you did very well, Mr. Gonzalez. You feel okay? Good.
Then, disconnect the suction catheter from the connecting tubing and dispose of your supplies. Document the procedure, including the amount and character of airway secretions.